mamas and mamas to be. This is the podcast that is going to take you into the Hen House. We are talking all things intuitive and mindful living and mothering, as well as preventing birth trauma and healing from birth trauma. We are bringing you real talk, real connection, real community, and hopefully some real inspiration as well. We are your hosts, Andrea
and Chantal.
And if you're ready, it's time to jump into the Hen House. Hello, welcome back, everyone. We're so glad to have you here. We have a super special guest today. We are welcoming Darian Hill, and she is a doula here in the Chattanooga area. And welcome, Darian.
Thank you so much for having me.
Yeah, I'm so excited to hear your thoughts today and perspectives. And so to get started, can you tell us, I feel like a lot of people don't know, what is a doula?
Well, by definition, a doula is a trained professional who is there to support the family during childbirth, postpartum, prenatal, everything, during the experience of having a child. And that could be physically, emotionally, mentally, informationally, because we are usually more educated and the procedures surrounding delivery, and we can kind of, I guess you would consider it throwing out realistic expectations and help clarify any misunderstandings.
Brilliant. Yeah, I love that. And that, I think, is something that can certainly happen to just, especially if you've not done it, to have no idea what to expect. And I think having help and support makes such a difference. I am a huge supporter of having support, I guess. And so I had a doula for my birth, and she's an angel. It was like, wow, I think this was the only person actually really, really, really on my team outside of my husband. And, you know, husbands they're kind of in it with you. So how calm and collected they are the whole way through is kind of a question mark sometimes. But
yeah.
But so tell us, what kind of support would a doula offer through the whole pregnancy process?
So during the pregnancy, especially if it's your first child, we can offer clarity and help someone advocate for themselves, give them ideas of questions that they should ask their provider, and we can kind of help translate for them. And I know a lot of people think that doulas might replace their partner, but that's really not the case. We're there to help the partners learn to support their wife or their partner during that transitional period.
Yeah, that's amazing. Yeah. So, and I believe it includes both kind of the emotional support, but also during labor, definitely the physical support as well.
It is very much. It's important to ask them how the changes in their life are affecting them, you know, because if we're stuck on an emotion, you often find that things stall. Fears can make it really difficult and can lead into postpartum depression or even depression during pregnancy. And so we have to just check in regularly and be like, you know, how is this this happening? You know, like, as it's happening to you, how are you experiencing it? How does it make you feel? You know, and just try and help them work through their emotions as it's happening to them, because sometimes they don't know how they're supposed to feel. in that type of situation, um, especially during labor. So,
Yeah. Yeah. Well, labor is so intense
yes.
and it can be overwhelming at times for sure.
Oh, yeah.
And I feel like there's an element of both pregnancy, labor and delivery, and then like the earlier postpartum. And when I say earlier, I mean maybe even like the first 6 months,
Oh,
where
yeah.
there can be a lot of irrational thoughts or worries, and it can maybe just be helpful just to have a sounding board.
Oh, yeah. And it's your body goes through a lot of changes, and you're flooded with these emotions, and some of them are like really feel good emotions and hormones, and then sometimes um, other things will creep in, and it helps to have somebody that's stable and that's been through it, that's like, okay, this person's done this before and they're saying they're not worried, so I shouldn't be worried either. And so it just kind of um, it's kind of like a heat sink, you know. It's like, okay, I'm going to warm myself on this person because they're not concerned, and it's going to spread to me, and now I'm going to be warm. And it it's it's really impactful to be there to support the person just by being a calm, level head, and just be like, I'm not worried about it. It's fine.
Yeah.
Everything is fine. You know.
Yeah, that's brilliant. I love that. And such a good analogy. And it's so true because actually I was horribly worried during pregnancy about postpartum depression. Hard to say why, but I was. And to
Mhm.
just have someone say, like, to have information and just be like, hey, I'm not seeing any signs. And if something does come up, I'll be here right with you and we'll deal with it as it comes. And here, I found a podcast for you. Maybe you'll find this interesting and helpful. It's a medical doctor talking about vitamin D
Mhm.
and in pregnancy. And, so um, it helped me, even though I knew a lot of what to expect going into it because I'd been working with mostly pregnant women and new babies and basically all moms for like 7 years already, almost exclusively. And so I knew a lot, but it's different when it's you feeling it and you get these like, and I'm like, I might be being irrational, but I don't really know. I've not done this before. So
Yeah.
it was really helpful.
Yeah. It You do have that, and even if you've been through pregnancy before, every pregnancy is different, and so you don't know what to expect going into a new pregnancy. And so it kind of helps to have someone who's seen a lot, and they're like, oh, you're doing so good. You may be comparing yourself to other moms. You're like, oh, I'm so worried because I know Allison's mom was able to bounce right back after having a baby, and I just feel like a couch potato. And you're like, no, but you're doing so good. You had a C-section and you're taking care of yourself. Or, you had twins. You have to really like be proud of yourself, because Allison's mom only had, one baby, and she was a go-getter afterwards. But we have to remember that we can't compare our bodies and our experiences to other people's, because just like our pregnancies are different, our postpartum journey is completely different as well. And we as people, our bodies are all different, and how we handle things are different. And there's just varying aspects to our healing and our mental stability and our environment. So we have to take that into consideration and give ourselves some grace. One of my favorite quotes is from Mama Dr. Jones, and she always says, we do the best that we can with the information that we have. And so you can't be mad about, if I had only known, or if I had done this differently. You have to go with the fact that you made the best decision at the time with the information you had. So,
Yes, I love that. And I love that you acknowledge how everybody's different and every pregnancy is different. and just every journey is different. And to let go of comparison, that is, like, I mean, seriously, probably like the best piece of wisdom for going into things, right? Like, I love that. For the women out there, because I have known many of them when I've suggested to work with a doula or to get childbirth education or things like that. And often people will say to me, "Oh, I have my midwife, I have my OB. They'll tell me everything I need to know. I don't need to, like, I don't need to do any of my own research. I don't need other support. They're going to be there with me. I don't, that's all I need. I'm good." What would you say to the women who are kind of going into it with that in their mind?
Yeah, and that's a really good question. I went into it with my first child with the exact same mentality. And looking back, doctors' offices and hospitals, they're very sterile and very clinical. I've never worked with a midwife personally, but they're very, whenever you're working with a practitioner, they're all about the performance of the science and how your body's behaving. And so a lot of their stuff is based off of textbook. And whenever it comes to labor's never textbooked, and it's important, regardless of what your doctor says, for you to stay informed. You shouldn't take everything at face value because it's not always going to apply to you. And it's really important for you to do your own research so you know when to ask questions, what questions to ask. And you put yourself, and I don't want to go blaming, it's definitely not victim blaming at all, but if you are going into it willingly refusing to do research and to take childbirth education classes, you're kind of setting yourself up for a very challenging experience because someone, take epidurals for just a brief explanation. A lot of people are under the impression that an epidural is just a quick shot and they can get up and they can walk around and they can move and dance and all this other stuff. And then it's a rude awakening when they discover that no, once you have an epidural, you are numb from the breast down. You cannot get up out of bed. You cannot support your own weight. And it doesn't always get rid of the pain. Sometimes you still feel things, and sometimes it doesn't work at all, and you're still confined. And there's the catheter aspect, and you're not going to know about these things unless you have somebody that's there that can tell you, like, these are your options for pain management. Here's the pros and cons, because your doctor, they don't have time, and neither does your midwife, to sit down and be like, here's what your options are. Here is the pros and cons of each one, and it's important for you to stay informed. Otherwise, you're making a decision without the proper information that you really need.
Right. Yeah, absolutely. And almost every intervention is going to it'll have its benefits and also its risks. And really only the mother knows ultimately the level of risk she wants to engage in. So can you tell me, how might the presence of a doula during labor and delivery change or affect the outcome of the birth for mom and for baby?
So they did some studies in the late 80s, early 90s, and those studies suggested that just having somebody in the room taking notes behind a curtain was enough to make a difference. And as things have evolved, it's no longer just some medical students sequestered to a corner behind a curtain with, a book. It's actually someone who's trained in the understanding of what's going on and who's there to help translate the situation to the parents. But we've seen, I think it's a 48% decrease in cesarean usage with a doula present. So they have obvious correlations between a doula being present and the decrease in need for intervention, such as a cesarean.
Yeah, that's huge. That's
Mm-hmm.
really huge.
And
Because,
I'm sorry.
yeah, no, cesareans are no joke. They are.
Yeah.
It gets played up like this little tiny procedure, but it's really very significant and very invasive. And the risk for mom
Mm-hmm.
during a massive surgery like that is significant for sure. So the reduction in that, I think, is an amazing thing.
Yeah, and I definitely was part of that group of people who um, believed, oh, you're not a real mom if you have a C-section. And I
Uh,
think that it's a lot of internalized misogyny, honestly. But after having, I've never experienced a C-section, but my sister had one and it was an emergency C-section. I wouldn't wish that upon my worst enemy. The healing process is so brutal, and she hemorrhaged. So I have, you know, there's obvious risk, and if we can do something to get rid of those numbers, then we're doing something good for sure.
yeah.
But doulas have also been found to increase the percentage of people who are breastfeeding their children as well.
Okay.
Because a lot of us are trained with lactation. And
Mm-hmm.
so you'll have like peer lactation consultants and international board certified lactation consultants. And that's their sole job, is to encourage people to breastfeed their child. Obviously, fed is best, but if you had a choice, breast is best. So
Yeah.
there's just so much that goes into it. The colostrum is just liquid gold. And so we try to encourage our patients to at least try breastfeeding for the first 2 weeks, and give them any pointers in the direction that they need if they need more in-depth assistance with that, because sometimes they just have tongue ties or lip ties or something that can prevent them from nursing properly. But so cesareans and breastfeeding have been studied, and they see a strong correlation between a doula being present and those numbers.
Wow. Yeah. And honestly, like, I think both are so important because
Mm-hmm.
even with breastfeeding, there's so much that goes into the creating of the bond and so much of transferring, the antibodies and um, just really, it's like I find breastfeeding so fascinating. And so I'm a big, it's like if we can help women do that easy, have it be easier, and so that they can be successful with that, especially if they want to be successful with that, is huge. And I'm also like, if you can get support with that, I had such a good experience with a lactation consultant. Once I left the hospital, I did not have a good experience in the hospital with lactation consultant, but I hired someone privately once we got out of the hospital, and it made a world of a difference for me, like a huge difference.
Yeah, I
Um,
mean, a lot of the hospitals, they have nurses who are trained as lactation consultants, and they're nurses first, and so a lot of times, even though they are acting as a lactation consultant or a counselor, um, they're still not afraid to give baby a pacifier or to offer supplementation, and sometimes that's just not necessary. Um, and they make it seem like there's a deadline and there's a lot of pressure, and there's not as much pressure as people believe, for sure.
right. Well, and I think when you have support and you're calm, it probably makes a lot of things easier. It makes labor and delivery easier.
Mm-hmm.
if you're calm. However, I think it also affects breastfeeding and makes the process of breastfeeding easier as well.
Absolutely. I definitely think that having people home in an environment that they're familiar with, that smells like them, that is, is their space, their safe space, is important because, you know, that's going to be the best place for them to deliver, like you said, for labor and delivery, having them home and in the space that's theirs and not surrounded by beeping machines and bright lights. So I can imagine that having a lactation consultant come to your house and kind of look you over and see how things are working in your own environment would be totally, like, so much better,
Yeah. Yeah. So talking about kind of frame of mind of mom, can you tell us a little bit about why it's important to consider mom's frame of mind during labor and delivery? Like,
Labor, birth is traumatic. It can be traumatic for everybody involved, whether you're the doctor or, you're a first time parent or a nurse. This could be your first birth or your 10th. It can still be traumatic. So it's important to kind of get a feel for where they're at, if they're feeling overwhelmed or they're getting extremely nervous or they're scared. Those emotions can stall labor and it can keep it from progressing properly, and it can ultimately result in a C-section. So it's important to try and relieve that from them, take that weight off their shoulders. And if you have to turn the lights down, or I've seen where doulas will decorate your hospital room. They'll put fairy lights up and curtains and put on soothing music and put some oils in, like a bracelet for aromas. And it can help relax somebody. But, if somebody has also experienced a loss previously or has had a really stressful pregnancy, you also have that to deal with. And it's really important to see them for, what they're experiencing, and to validate those feelings and those experiences, because it can cause issues during labor and, of course, postpartum. And postpartum depression is so important to recognize, and we're trying to avoid that.
yeah, goodness, absolutely. Postpartum depression is, um, it's a really, it can be so significant and really interfere with any enjoyment or connection that mom and baby feel in those early months or even year. And yeah, it's like if we can give people a better experience through pregnancy and birth in hopes of giving them a better postpartum, I just think everything is so worth it. So worth it. And
Indeed.
so, yeah, yeah, that's amazing. So I know previously we had talked a little bit about some of like the unique challenges of young moms and also of new moms and perhaps of first time young moms. I feel like I'm like in Dr. Seuss. Mouse house. No. um, but how can a doula kind of step into that kind of environment, let's say, and provide just that extra support that's needed, especially for our more vulnerable moms and moms to be?
So it's it's definitely a touchy subject, but it's one that I've personally experienced. Being 17 whenever I had my first child, we have to look at the statistics sometimes. And while people are very different, and the statistics are not, they don't fit everybody. So sometimes, many times, you see these young, vulnerable women by themselves, or they don't have any support. Their families sometimes are sometimes they're very lucky and they're very supportive, and sometimes they're on their own, especially if they're young, and they may not even have a partner there with them. And so we have to take that into consideration whenever we're going into this, because um, there could be some trauma, you know, um, not just from the pregnancy, but the whole experience. If they're by themselves or their family is threatened to disown them or they've been kicked out of their home, it's important to discuss these things leading up and to be as gentle as you can and to offer your support, and without judgment. It's important not to be judgmental, because I know I was very on edge and just felt like everybody who was looking at me was judging me and thinking the worst of me. Um, and it kind of rolls into your family life. And, my family they were pretty supportive. They were very disappointed. And that was very obvious in a lot of our interactions and their discussions with other people. But it kind of bled into it because, like, I would go to a store with my parents, and if my mom, when people are, when they're vulnerable and when they're young, like, I couldn't go to a store with my parents, and if my mom would kind of walk off and leave my stepdad with me, people were giving him some kind of nasty looks, because the appearance was that this grown man was with me, an older teenager, and I was very heavily pregnant. And so the assumptions that people made, and so it kind of resulted into, like, they're like, "Oh, I'm not ashamed of you. I just I just don't want to go anywhere with you." Um, and so I felt really bad for him, for sure. I did.
Yeah.
Um,
That's a tough thing, and I feel like most people don't think of that.
yeah.
I had and I wasn't pregnant, but I was probably like 22 or 23, and I went with my dad. My mom couldn't go for whatever reason, but he had this work banquet.
Mhm.
And he was the head of the company, or I don't know if he was the CEO then, but close. He was kind of the executive
Mhm.
branch of this company. And I went with him, but I was like, people are gonna give us weird looks, like, because they'd not met my mom. And I was like, they're gonna think that he's like married like a 20 something, like, you know,
He brought his midlife crisis to the
right,
the
to
banquet.
to the banquet. And it's kind of like a very conservative town. And and so he was like, okay, here's what we'll do. Come with me. And so he literally went to every table throughout the whole banquet hall and was like, I want to introduce you to my daughter. This is my daughter.
Yeah.
And
Yeah,
I think you don't think of that until all
you
of a sudden
don't.
people are giving you weird looks, and you're like,
Yeah, you don't think of that at all, and it was, nobody. I think we were at Home Depot or something, and this happened, and I had to run in with my dad, who's a plumber, and I felt so bad afterwards, because these women were just kinda giving him a side eye and, like, looking at me, and, um, I felt really bad, and then my mom would come up, and they're like, "Oh, okay." But I also, they young parents in general, we also need a lot of support. A lot of support. My my daughter would often be mistaken for my sister,
mm-hmm,
um, or if my mom went anywhere by herself with my daughter, or even with me, and it was really hard being present and experiencing that as well, where everyone's like, "Oh, your daughter's so cute," and my mom would be like, "It's my grandbaby." And my mom, who was 37 at the time, she's like, "It's my grandbaby. And they're like, oh. And so it was really hard. It was really hard on her, and it was um, it was really hard on me, because I just felt disregarded. So having experienced that firsthand, I really want to offer a support system to people who are experiencing the exact same thing, because you can get railroaded by the hospital system. I had my mom present for my birth, and I still felt like they were mistreating me. Um, I was all but like confined to my bed, and um, the nurse there was just so rude, and just kind of like made me feel like I was a bad person for being in this situation. And um, my my daughter's father was he was he was also 17, and he didn't have a car, was living in his parents, and so my stepdad had to go pick him up and bring him to the hospital. And so for most of my labor, the only person that was there was my mom. And my daughter's father made it probably within an hour of her being born, but the entire time you could just feel they were judging me. And it's really hard. It's really hard, to be going through this crazy experience. You're in pain, you're uncomfortable, all this stuff is happening to you, and while you understand what's going on because you've prepared yourself, or somebody else has prepared you, um, you don't think about the emotional side of things and the support that you desperately need from somebody who is close to you or who cares about you. Um, so it made it really, really hard. Um, and I think that as a doula, part of the emotional support that we can offer is to be the oil on the duck's back, you know, um, and these words just slide right off, the glares, nobody notices. And it's just like, um, you're doing so good. Like you're doing fantastic. Like what color hair is the baby going to have? Like you need to talk about it and get them super excited about the situation, because they're going to feel so overwhelmed and like, I'm going to be such a horrible mom. How am I supposed to be a good mom whenever I'm so young? And it's, um, yeah, like I said, you have to think of the statistics whenever it comes to this type of situation, because other people are definitely going to treat you like a statistic, whether you are or not.
Right.
And it can be really hard.
Yeah, so much sense. And I think also for all of the rest of us as mothers, especially if we're a little bit older mothers,
Mm-hmm.
to remember our own compassion and to put judgments aside, because no pregnant mom or new mom needs more judgment,
Yeah.
especially if you're already really vulnerable to begin with.
Yeah, and a lot of people they don't put that together, They're like, oh, this baby must have been an accident, or like, you must have been really irresponsible. And it's important to realize that a lot of times, like, that's not the case. And you may hear of these horrible statistics of like girls who are just sleeping around or in really bad areas, or bad situations, or and you can't think like that. You can't treat people like that. It doesn't matter how old you are, how much experience you have. um, if you put your daughter in that person's shoes, it's like, would you want somebody to treat your daughter like you're treating that person? Like that young parent. Like, would you want somebody to be like,
Yeah.
oh, hey, by the way, did you know that like young parents or teenage parents are more likely to live the rest of their life in poverty? I was like, you're supposed to hear that. You know, how would you feel if someone said that to your daughter? You probably want to knock them on their tail. I know my mom would have, you know.
Right? Right?
So, but yeah, they need a lot of support, way more support than the rest of us do.
Right? And again, I don't have a research paper to back this up, but but I'm just sitting here going, even if that's true, and young moms are more likely to remain in poverty or lower income for the rest of their life, I would argue it's only because they're not supported and not given opportunities, and they might just need a little bit of extra support. You know what I mean?
And that is actually very true because I've met several people who were very, very young moms, 16 years old at the first time of their first child. And I believe, like, even Nurse Hadley said that she was really young when she had her first child. And she is a hospice nurse who owns her own company. And, she's defied that. And then I worked with a nurse practitioner who had her daughter when she was 17, and went to nursing school, and she went to nurse practitioner school, and she was like, I was a mom during the day and then was taking classes at night and then working full time. And um a lot of times the common factor is that they had a really strong support system. And that doesn't have to be your partner. Your partner can be the most like unsupportive person in the world, then they don't need to be your partner anymore. But um they could just be family or like a really strong friend network, you know? It That's why they say it takes a village. It doesn't take a family tree. It takes a village. It takes the baker's wife and the whittler, and so it takes everybody, not just not just the family that you came from, but the family you create to be that support system that you need during that time.
Yes. Yes. Yeah, I love that. Community is like a solid, loving, supportive community is it just makes a world of a difference. And I think that's true regardless of how old you are, and
Hmm.
especially if you are more vulnerable. And sometimes finding that can be challenging. However, it's like if you have that, then like the sky's not even the limit. And one of my friends had said, like, there's no one that will work harder than a single mom. Like there's no one who somehow performs like literal like miracles, and it can practically be in like three places at once. You're like, how do you do it? Like there's no one who can perform like magician trick magic better than a single mom.
Yeah, yeah. We've got, two extra, arms that somehow, you become almost omniscient. It's like it's been really quiet. It's been really quiet. And then you almost kind of expect to see like what's going on in the other room. So I mean, you definitely, because I've been on that side too. So
So then tell us a little bit. So, like you've explained the role of a doula a little bit, but can you
it's,
kind of differentiate a little bit? Like, how would that differ from, let's say, like a midwife's assistant, or let's say your nurse if you have a hospital birth, or something like that? Who, like, from the people involved with your labor and delivery who are typically considered more like the helpers, like who do offer some support to you.
yeah, and this is actually like this is a really controversial topic, and it's really important to me because doulas are not clinical practitioners. We're not going to check your blood pressure. We're not going to check your cervix. That's not our job. That's not, you know, our insurance isn't going to cover it if we do something wrong because it's not in our scope of practice. We're not going to deliver your baby. So like we differentiate because a midwife's assistant is a clinical practitioner. They are a professional who is trained to take blood pressures, and some of them are even trained to check cervixes and see your dilation or to draw blood. Or and while doulas can hold training, like I'm a phlebotomist and a dialysis technician, I cannot say I'm a doula and then go practice like I'm not a doula. So if you're under the umbrella of doula, you cannot use your former training like that. So we had a lot of nurses in our training, and like you can use your knowledge to help kind of explain what's going on to the partner or to the parents, but you can't assume the role of doula and then pretend to be someone else, um, and then not do what a doula does. Midwives, they're the ones that are going to catch your baby. Those are your care team, whereas the doula is a paid, informed member of your support team. And it's very important to differentiate the two teams, because they are going to be the two most important groups during labor and delivery. You got to know who's there, what their role is, and that way that machine is running very smooth.
I think that's really good, really, really good to know. And I do feel like sometimes things have gotten blurred with that. Like I had a patient years ago, and she had a home birth, but she said her midwife was there, but her midwife didn't bring any assistance with her. So her midwife kept asking her doula, like, I need you to help me with this. Ooh, can you do this? And she was like, I'm not paying her for that. Like, get back over here and
Yeah.
like be my support person. Like, where are you going?
Yeah, and you've seen like there are people on social media. I think there was an influencer, moms over 35 or birth over 35 or something like that. She made a post about how there are doulas that are checking cervixes for dilation, and they are trying to assume the role of like a home birth caregiver. And she was very angry about it, being an OBGYN. And, I feel for her because I'm angry about it too. There are people, I had a client who reached out recently, and she was like, oh, hey, I don't have a lot of money and I'm looking for a midwife or a doula because I'm looking to deliver at home. And I was like, okay, well, we need to get a couple of things straight, because doulas and midwives cannot, we cannot be, we're not interchangeable. A doula is someone that would be there to help your partner or your mom or whoever's there. A midwife is going to be the one catching the baby, and I'm not going to be present for like a free birth, because there's too much risk to the people involved, the parent or to the child, and I don't want that to fall on me. Doulas cannot be delivering children, and they can't be assuming the role of a midwife without the proper training.
Right. Well, and a midwife too, in the case of a home birth, would also be kind of the one to collectively with the parents, but still like to say, no, you need to transfer. Like this is time. This is not working well. Something's wrong. Something's off. And like, so it's like they're kind of the one taking on the responsibility for it if something goes emergent.
Oh yeah, absolutely.
And to make that clinical call.
Yeah, that is, and it's very important for them to see where that line is, because I know a lot of midwives, I think legally, it depends on which state, but they're not allowed to deliver at home after 42 weeks. and I think it's before 37. I would have to check my sources on that one, but they do have limitations on like the gestational age of the baby for delivery to be legal and in their scope, because before and after those points, it's considered a high risk delivery. Um, and midwives, they're really good at gauging, when it's time to transfer, because their job is to try and, offer you the home birth that you're paying for, but you're also paying them for their expertise and their knowledge on knowing when it's time to call it.
Right.
So,
Right. Well, and in the case of a midwife, I believe also that often, let's say you call your midwife and say, "Hey, I'm in labor." She might say, "Great, labor for a while. Call me like, when, basically just before pushing is going to start."
whew,
Right? At least that's was kind of the opinion of my midwife, which I didn't know going into it.
mhm,
Now I actually ended up going into preterm labor, so I transferred at the beginning, but she had said she would still come to the hospital for a little bit and be there to support. But she was kind of like, "I'm only going to come right at the end, so you do your thing, and you know, when your contractions are like when you're super far into active labor, then give me a call and we'll see how I'm feeling about things." Was
yeah,
kind of her perspective once we got to that. But and I think I don't know that I had realized that going into it. It's like, wow, your midwife could actually be completely absent for the majority of your labor, depending
mhm,
how long it is. Like you could go through a whole lot of labor on your own. Um, before it's like, okay, things are like really, really happening here. And then she's like jumping in the car and hoping to make it before the baby comes out on its own. You know what I mean? So
yeah,
it's, which is worth talking to your provider about, like,
oh
I
yeah.
mean, ahead of time too. But so
I've
I
been,
think sometimes you get like a little bit less continuous support than you might have in your head.
yeah, it's really important to have those realistic expectations. I've been on the receiving end of that, not from a midwife, but from an obstetrician who um, we called in, and I had had my membrane swept at literally like 4:30 p.m. Um, and we called in at 8, and I'm like, I'm in active labor. I can tell. They're like, has your water broken? I'm like, no, it's not, but it's never broken on its own before. And then they're like, okay, well, how far away or apart are the contractions? They're about 10 to 15 minutes. And they're like, oh, well, let's delay that and, give it another hour. And then 15 minutes went to 2 to 3 minutes. I was like, I don't have another hour. And so I almost had the baby in the ER, like the waiting room.
Yeah.
You also, like, especially if it's not your first baby, whenever it's your first baby, like, you're not gonna know like the signs or how your body's gonna handle it. But with every like following pregnancy, it's going to be a little bit different, but the signs are still going to be there. Um, you're going to be like, oh, I can't talk anymore, and it's like, well, you might be in transition. Or, oh, she's yelling at me, we probably need to call the midwife. And so it's important for the partner to look out for that too. It's like, well, she was fine, she's eating pizza 1 second, and then she just started, chanting. I don't know that we can, wait much longer. I don't think you got time for a shower, ma'am. I'm sorry. So,
Right? It's like, no, you're things are happening all of a sudden.
oh yeah, and things
things
can
things are
move
happening.
super quickly. And my trainer, she said it's important to remember that when you're in labor, your dilation isn't a elevator that you're getting on and, some toddler has pushed all the buttons from 1 to 10. Um, so you're not stopping on every floor. And so there could be times whenever you come into the hospital and they check you and you're a 2, and then 5 minutes later you're an 8. And so it's like you
Yeah.
didn't miss those floors, you didn't just like miss the stop. It just jumped, and it happens like that so quickly.
Right. Well, because it could take you, 8 hours to do the first few centimeters, and then you could do the last of them
In 5
in
minutes.
like super quick,
Super quick.
like it could be like 30 minutes, and all of a sudden you're like, whoa, we're here.
Oh yeah. I was
So,
definitely there 15 hours to get to 6 centimeters, and then they checked me an hour after my epidural, and I was at 7, and then I called her back in maybe 10 minutes later and was like, I'm feeling something, and I was at a 10. So like it can happen really quickly, and you just have to pay attention. You have to be on the ball.
yeah. Well, and I do feel like that is another area that a doula can support mom in being someone who is listening to her
Mhm.
and saying, I hear what you're saying. This is what you believe is happening. So let me help you rally the rest of the team here,
Mhm.
because
Sorry.
I don't know, in my experience, the people actually responsible for the clinical part of it, I had an
Mhm.
unusual labor and they just discounted everything I said.
Oof.
And so I
Yeah.
said, hey, I'm there. I need to start pushing. And they wouldn't believe me. They're like, no, you're not there. And, and it was literally the doula was the only person who had been in the room during the night. I mean, my husband was there, but he was sleeping. So she
Mhm.
was the only one who was like, no, I can tell you, like, this is what was going on. So even though she's talking again right now, like it's worth not discounting it. Like,
Yeah, and
and she didn't necessarily say that, but she had the information
mhm.
of like, this is what I observed. This is the numbers. This was the contractions I counted for the last 4 hours.
Yeah,
you
and
know,
that was definitely something that, because I've not had a doula with either of my births, and um, I probably could have used one a couple of times. Um, but it's really important to remember, even if you're not a doula, and you could be a nurse and you're just watching or listening. Um, it's important to remember that the patient is going to know themselves better than you are because you just met them, and you have to take their concerns seriously, and you can't just discredit them because, oh, my textbook says that they're supposed to, contractions are supposed to, build up to this point or be nonstop for X amount of time before. And it's like, yeah, well, your textbook needs to go in a fire because there's a difference between educational and practical. Because your
right?
education is going to tell you one thing, but in practice, you'll realize these are totally different.
Very few humans have read the textbook.
Yeah. Well, or a lot of people are just reading the textbook and then going out and expecting it to be exactly like that, and in reality, it's not. And then they're getting disappointed, and they're like, I don't know what to do.
Right, right. Yeah. Yeah. So it's just any, like, a supportive birth team is also like what did you said, the, not the support team, but the,
The
like,
care
more,
team.
yes, the care team.
Yeah.
And really choosing wisely on both sides of things is really important.
Yes,
Um,
and people need to remember that you could be 10 centimeters. You can fire a doctor. You can fire a nurse. Um, like those are your options. And if they tell you no, then at that point, it's legally it is considered assault for them to touch you. Um, and that's just from my training. So like if someone tells you you're not allowed to touch them, do not want you to touch them, then you can't, because it could be a lawsuit at that point. And so, and implied consent does not supersede um, direct, like verbal denial, or declination. So we have to remember that too.
Yeah, and that's good to know. And that I think is where a support team member who is, and I think to me that's a little bit the differentiation between a doula and perhaps the care team. Because
Mm-hmm.
let's say in a hospital setting, it's the hospital system. So everyone who works in that system, yes, they definitely care about the patient,
Mm-hmm.
at least for the most part, I think. However, it's their loyalty is also to the hospital,
Yes.
and nurses may be hesitant to contradict the OBs. And, and then the OBs, if as a mother you're saying, no, I need to go this direction with things, well, they all of a sudden then need to answer to the hospital system and to the legal team and to whoever else, administration of the hospital, because why are they acting not in perfect accordance with policy?
Yes.
And there can be confusion with that. Whereas for a doula, I kind of feel like, okay, you know what? That's someone whose loyalty should at least lie with the mom first and foremost.
Yes, absolutely. And we have to remember that there's whenever it comes to a doctor and a doula, there's only one of them that is getting paid differently depending on the outcome of the labor, and it's not the doula. So, if it winds up going into cesarean or other interventions are used, if they wind up getting an epidural, or the doula is getting paid the exact same amount, the exact flat rate that is in the contract, as opposed to the doctor, who is now getting paid $400 or $500 more because, oh, now we have to perform an episiotomy, or $1,000 or more because, oh, now you need a C-section. But then you also have to remember that doctors are going to be really quick to jump the gun because they have their own insurances to report to. And so
Yeah.
their malpractice insurance is, if something were to happen, they're going to be like, why didn't you intervene beforehand? And, so they've become overly cautious, unless they're not betting people. They're like, oh, well, it looked like it was going to take a little while, so I just sent her to cesarean. But she was progressing fine. It was just, I was going to miss my dinner with my mom or something.
Right. Right. There can be conflicts of interest for
Absolutely.
sure. Yeah. Yeah. So if someone's looking for a doula, how would you recommend finding one?
They can call, like, you can go to Google and look up doula services in my area, or like whatever state you're in, city. There is a website called meetyourdoula.com. You can go to dona.org and they have a find a doula search. So there are a bunch of resources out there. If you're seeing a midwife, they'll often have doulas available that the midwife recommends, or I've not really seen it as much at OB's offices, but I've slowly started to get the understanding that OBs and doulas are kind of at odds with one another. So,
They may be. I think there are some states and some hospitals where doulas have been banned
mm-hmm.
because heaven forbid a woman have support during her labor.
Oh yeah, like who's
You
going
know?
to advocate for her? Who's going to advocate for her? Because, and they're like, well, that's her care team's job. And it's like, no, her care team is going to do what's best for the care team and the hospital. They don't care about the patient. They'll cut the patient from navel to neck, and they don't care. they're,
Well, as long as someone doesn't die, because, then I imagine they have a lot of extra paperwork.
yeah,
I'm
as
being
long
a
as,
little bit over the top. I think a
yeah,
lot of OBs and nurses do genuinely care.
they
And
care.
and they have to answer
Yeah.
to the hospital system, which is a Goliath of a system.
Well, they've got those board members that they need to appease, but they also have insurance that they need to compete with. And um, personally, I'm, I'm hoping that I'll be able to have my next child at home with midwife because I'm not going to be restricted by insurance, because that'll also have an impact on what type of care you can or cannot have. And not all insurances cover doula services, and then not all insurances cover midwives, and you know, but oh, it's a pain. It's a pain.
Yeah, and I get that finances are often a big piece for women,
Mhm.
and I also think you really have to look at what is your desired outcome.
Mhm.
Because for me personally, went into this saying, if I can avoid a hospital, I'm going to avoid a hospital because I'm a little, I'm really actually quite naturally minded. I don't consider myself extreme, but from a hospital perspective, I'm extreme. And so I was like, I would rather pay the 6 or 7 grand and have a home birth. I'm like, I'm fine with that.
Yeah, I mean,
You
with the way
know.
insurance is nowadays, like you're probably going to be footing that type of bill if you have a hospital birth, anyways, and
Yes.
you're going to
So
enjoy it way less.
my hospital bill was over 50,000.
I lucked out. I had I was insured through the state with my first one because I was still really young. I was under TRICARE with my second one, and TRICARE covers everything. They
That's
cover,
good.
and they even cover doula services. So
Oh, wow.
yeah,
Okay.
they cover doula services for TRICARE for members of military families, and so like that is amazing. I was an army wife, and um, no one ever told me this. No one ever said,
Yeah.
"Oh yeah, you could have a doula or you could have a home birth and we'll pay for it." No one ever said this to me, and so
Right. Well, and that's something to, I guess, for people to keep in mind too, is your insurance might pay for it. So it's worth asking,
yeah, and
you
you've
know.
got the what is it, the FSA or something like
Oh,
that?
like the health savings accounts or
Yes,
things like that.
yes, because they actually have it where you can pay for the services of a doula, with that account, depending on which account you have. I believe the FSA, and I think you have to use the HSA. Um, but you can pay for a midwife out of it, and you can pay for a doula. And then some people have even started offering, like some companies have started offering this insurance called Carrot, and Carrot will also cover doula services for expectant parents. And so
Okay.
it's evolving.
Yeah, no, yeah, I mean, I do feel like that indicates that it's becoming a little bit more mainstream, which is great.
Yeah,
And so, would you recommend interviewing several doulas ahead of time, or how would you kind of go about after you've done your Google searches or talk to people? How would you kind of find the one that's the right fit for you?
I would highly recommend, and you don't even have to be pregnant to start interviewing. If you and your partner are, trying to conceive, and you're like, I know from the start, I want the support, because some doulas are even trained in like
Mm-hmm.
fertility doula, so like they can walk with you through a fertility journey with IVF and through loss. So I highly encourage you, either like at the time that you're trying to conceive or from the time that you find out you're pregnant, to start looking for a doula, um, and interview everyone that you can get your hands on, because it is so important. Not only, like, price matters, sure, but you have to be able to have a connection with a person, because this person is going to be a non-family member in this room that's going to be there for hours and they're going to see the most vulnerable parts of you. Um, and so it's really important that you have a connection with somebody, and that they are soothing, and that they seem knowledgeable, and they say, what is it, the vibes? You want to make sure that the vibes are there, because if they're not, then you need to listen to that, because it could be the wrong person for you. And you don't want, like, a lot of people will go, like, allow money to guide them, and they're like, oh, I went with the cheapest doula I could find. And while, like me, for instance, I have a sorely discounted service fee right now, because I have to have 3 births that I attend, and I have to have you fill out paperwork afterwards. And so I'm like, for your pain and suffering, I'm giving you this. So um, I I'm only charging $650 for my services, as opposed to the mean, which is like $1,400 in Chattanooga. Um, and that is just because I feel like it would be wrong for me to charge more, given I'm going to have you fill out a piece of paper, or like some paperwork afterwards. Interview everybody. Don't let
Mm-hmm.
don't let the cost of it guide you, because the most expensive person could, yeah, like a lot of people are like, oh, it's more expensive, so it's so much better. And it's like, I don't know if I've still seen a Gucci purse fall apart. um, so we have to remember that just because it says it's Gucci doesn't mean that it's high quality. um, and just because it's cheap doesn't mean that it's the best for you either. Because you do pay what you get for, like, you get what you pay for, 100%. Um, but sometimes you're not going to know that this person isn't just really bad at their job until you talk to them and you interview with them, and they're like, this person should be charging more. It's like, well, maybe there's a reason they're not charging more. Maybe, they're in training, or they want to get above 10 bursts before they raise their prices, or maybe it's just a side hustle for them, and like a side passion project. So it's
Right.
important to interview everybody who will respond.
Yeah, definitely. And I think even if you make a choice and get into it and decide this is just not what I thought it was,
Hmm.
it's okay to make a change then too.
Yeah.
You
I
know.
mean, at the time that you hire your doula, they make you sign a contract. You do pay um, like a reservation fee, because they're setting aside time of their life, in the future. But if you go to that first prenatal appointment, and um, it's just the space is all wrong, and um, you don't meld well together, you can always cancel. You can always, void the contract and be like, look, this isn't, we are not, we're not vibing. And a good doula will also be like, okay, I'm getting the sense that we don't vibe very well together. I can recommend some other people who are really good and in roughly the same price range that I'm in, and maybe they will be a little bit better um, for you. So if you're good, if you're a good doula, and you're not just focused on paycheck, then you'll be able to recognize that something's off. They don't feel really into it. Um, so you can either choose to cut them loose, or um, ask them how they feel about it. And it's just like you have to have an adult conversation about it. But you can cancel at any time. It just depends on the contract as well. But you're not like held prisoner when you sign the contract, you know.
It may cost you a little extra to change, but
Yeah, I mean, I've not seen any that have like cancellation fees, but I have seen where if you cancel, then you're basically forfeiting like your deposit. A lot of the deposits, the retainer fees are non-refundable. Um, so I have seen that. And
right. And so it's just each person, I guess it depends.
mhm.
You get to place your value system on it and say, is this working for me? What do I want? And everybody gets to make their choices, right? So
I mean,
it's good to have
free.
options. It's good to know you have options,
Yes,
at
indeed.
least.
That's what free will is for. And, for now, it's a free country. So we have the ability to make decisions. Um, and it's best to make sure that we're informed with every decision that we make. And, it's okay to interview one doula and fall in love with them. It's okay for that to happen, but I still would recommend interviewing with another two just to make sure that it wasn't just rose colored glasses or like, um,
The hormone cocktail of the day.
yeah, it could just be, I know that whenever I was interviewing and stuff, because I was looking for a midwife, I got so caught up with, the environment and everything. I was like, God, I love this person. And then, you know, it may not work out. And so it's important that like, just even if you feel like it's right, test the waters a little bit, because it could just be a warm spot. You don't want it to be like that.
Right. Before we wrap up, is there anything else that you would like to share?
I think it's really important for everybody to stay informed. And whether you go with a doula or you don't, or whether you go with a midwife or you stick to the hospital the traditional way, no matter what route you take for your labor, your delivery, your plans, just make sure you're staying informed, because there are a lot of things that can happen, and things can change really quickly. And so do your research, read a book or two, talk to people. And even if you want to talk to a doula to just like ask questions, that's always, an option too. You don't have to hire us for us to answer some questions that you might have. So I guess that's it. Just make sure that you're staying informed and you're considering your source as well. Because if they have a financial stake in the outcome of the situation, then it's going to be a little bit difficult for you to take their word as it is.
I agree. I so agree. I think that to be informed and to ask questions and to also remain critically thinking
Mm-hmm.
Is also really, really important for having, hopefully, your best outcome possible, which ultimately is my goodness. I mean, if more women could have excellent outcomes and come out of it and say, you know what, like, I felt empowered, I felt listened to, I felt supported.
Yeah.
I mean, that would be, that would be huge. I think that would be huge. And my goodness, I hope that that's something that is happening by the time
Mm-hmm.
that my daughter and your daughter are, possibly giving birth themselves.
Well, my daughter just turned 12, and she's been very clear that she doesn't want to have children. And so if
Okay.
that's her choice.
Well,
would definitely
You know
prefer.
what? It's everyone gets to decide that too.
Yes, yes, but
So,
I definitely think that there would be more children in the world if the experience that people have in the delivery room, because it's not usually the pregnancy and the birth that scare people away from having a second child. It's usually the experience that they had in the delivery room that kind of deters them. And so I definitely think there'd be more children in the world if everybody experienced an excellent birth. So,
right. If people coming out of it, because there's probably still always going to be some trauma, but if you could
yeah,
say, hey, you know what? My trauma was kind of unpreventable, and everyone did the best they could to support me, regardless of things kind of going wrong, as opposed to, oh my goodness, my whole care team, they were the cause of all of my trauma. I mean, if
yeah,
we could move like a little bit out of that, I think that would be beneficial.
yeah, it's like, hey, it's one of those times when, everyone else are like, oh, perspective matters. You have to take a step back and look at the bigger picture. And it's like, in labor, you don't want to take a step back. You want to be really close and be like, wow, I really killed that. That was so good.
Right?
I did amazing.
Right?
And
Right?
then it's
I
like,
mean,
well, what
that's,
did the doctor
yeah.
do? I don't know. I was too focused on myself.
Well, I mean, if there's one time to be entirely self focused, that would really be it. It's like you
100%.
don't want to be too mental. You just want to be like really like in your
Yes.
body and present and
Yes,
like
absolutely.
doing your thing because, it takes a lot of concentration.
It does. It does take a
For
lot of
sure.
concentration and a lot of discipline in some manners. So, um, if you're able to if you're able to kind of center yourself and focus on yourself and your child, then the outcome is going to be so much better than if you were worried about what your husband's doing, or, oh my gosh, my mother in law just came in and she's taking photos of me exposed, which is something that doulas are great at. You need to get out.
Right. Yeah, that was no, it wasn't my mother-in-law, it was my mother. Well, actually, and my dad, they both barged in and I was like, someone take care of that.
Yeah,
And she's like, on it. Here, let me take what you've brought. Thank you so much. Now off you go. We'll call you later.
that's amazing.
I know. I don't think I was exposed at the time. I really don't remember, but I don't think I was exposed. But I was like, no, I don't need more company. I'm good.
Yeah. I know, there was someone who was talking about how, her husband was getting kinda queasy right after the epidural happened, and so the doula was like, "Hey, here's her cup. Can you go, ask the nurses for more ice?" And so he's like, "Yeah," and he just walks out. He's, like, droned, and she was like, "Yeah, he just needed to get out of there because he was gonna pass out if he didn't stop looking at the needle."
Right. Thank you so much, Darian. This has just been so much fun, and I love all the information and the perspective and the humor. And thank you so much for joining me today. I'm
Yeah,
truly
absolutely.
very grateful.
Thank you for having me. I appreciate it. It was a great experience.
Yes, and thank you everyone for listening and for viewing. And I'm going to have all of Darian's information in the show notes, so you can definitely look her up. We'll include all of her social media and website and all of that. Um, and yeah, so if you want to connect with her later, you can do that. And all right, well, we are complete for today, but thank you, thank you, thank you to everyone, and we will see you all soon. Thank you for being here today. If you are loving this podcast, please go ahead and subscribe, and we would love if you would leave us a review. Sending so much love for you into this week, and we will see you soon.